Nobody wants to think of their beloved pet getting sick. What if there were a way to prevent many of the life-threatening diseases cats acquire? One of the greatest areas of progress in veterinary medicine in the last 50 years is the prevention of disease through the use of vaccinations. We will discuss how your cat might be exposed to diseases, how vaccinations work, the different types of diseases, and how to prevent disease through vaccinating your pet. Many cat diseases are the result of a specific virus or bacteria infecting your pet. These infections can be spread by close contact with other cats. Cats can also contract diseases by being exposed to the feces or urine of another cat. Some viruses and bacteria can even be carried into your home on clothing or shoes. The more cats you and your pet are exposed to, the greater the risk of your cat contracting an infectious disease. Kittens receive natural immunity to many of these life-threatening diseases from their mother's milk or colostrum. These antibodies help to protect the kitten for the first several weeks of life. Most kitten vaccination programs begin between 6 and 8 weeks of age, when the maternal antibodies have begun to fade. Prior to receiving a vaccine, your veterinarian will perform a thorough physical exam. The evaluation of your pet's physical health and the determination of any existing disease is very important. Once your veterinarian has determined that your cat is healthy and ready for the vaccine, they will administer the injection through a small, sterile needle. A vaccine introduces a safe form of the disease. Each time the pet is vaccinated, they produce antibodies directed toward the actual virus or bacteria. After the boosters are given at a 3 to 4 week interval, a kitten's immune system is equipped to fight off the actual disease. Boostering these vaccinations periodically protects the cat throughout life. One vaccination used routinely for kittens and adult cats is called the feline distemper combination. This is a combined vaccine because it protects against multiple diseases. You may notice the abbreviation FVRCPC on the vaccine that your veterinarian gives. Each letter represents the name of the diseases it protects against. These include feline viral rhinotracheitis, calicivirus, panleukopenia, and chlamydia. The kitten vaccination series usually begins with the feline distemper combination given between 6 and 8 weeks of age and ending at 16 weeks of age. Kittens will be boosted 3 to 4 times during this period depending on the age their vaccination series began and your veterinarian's preference. These initial vaccines are perhaps the most significant disease protection that your cat will receive, so you'll want to closely follow your veterinarian's recommended schedule. After the initial kitten series, this vaccine is administered as an annual injection to adult cats. Feline leukemia is a very serious disease and is a common killer of pet cats. Many cats will harbor the virus and spread it to other cats before they begin to show symptoms of the disease, making this an even more serious problem. This virus is very contagious. Kittens can contract the virus from their mother if she is infected even before they were born. This virus severely weakens the cat's immune system and reduces the body's ability to fight infections, other diseases, and increases the risk of cancer development. There is no treatment available for this viral disease. It is strongly recommended that all cats be tested for the presence of feline leukemia and appropriately vaccinated against this deadly disease. Kittens are normally vaccinated against feline leukemia at 10 to 12 weeks of age, and this should be boosted again 3 weeks later. It is then boosted annually in adult cats. State law mandates that the rabies vaccination be administered to all cats. Although the rabies vaccine is generally given every 1 to 3 years, this will vary from state to state depending on the degree of exposure. This vaccine does not require repeated dosings during the kitten vaccination series due to the highly effective immune response that it creates. Most rabies vaccinations are given initially between 12 to 16 weeks of age. There are several other vaccines available for pets that may be at a higher risk for a particular disease. One example is the feline infectious peritonitis, or FIP vaccine. Your veterinarian is aware of your cat's preventive needs and will recommend any additional vaccines that should be needed. Mild reactions to vaccines do occur occasionally. Slight lethargy, loss of appetite, or tenderness and mild swelling near the injection site are possible reactions that some cats exhibit for 24 to 48 hours after being vaccinated. The very small risk of a vaccine-related side effect is greatly outweighed by the benefit of protection against a serious or fatal disease. If a prominent vaccine reaction occurs, contact your veterinarian immediately for recommendations or treatment. Your veterinarian will be able to assess the needs of your pet and administer the appropriate vaccines to provide prolonged immunity against disease. Remember, an ounce of prevention may save the life of your beloved cat.